Welcome to the overview for the Atlas Supreme Health Plan here on the far right. This plan has a $0 deductible, which means the plan offers first dollar benefits. You don't have to meet any deductible amount before the plan starts paying for costs. More on that in a second. The out-of-pocket maximum amount is $5,000 for the primary member and $5,000 collectively for the rest of the family. So $5,000 individual, $10,000 family out-of-pocket maximum. The plan uses the PHCS practitioner and ancillary network, a giant network of providers with likely tons of options in your area. And facilities are priced at reference based pricing, which means no matter what facility you go to, you're going to get a great rate. The Supreme Health Plan covers 100% all mandated minimum essential coverages as mandated by the ACA, Affordable Care Act. So things like immunizations, annual physicals, colonoscopies and mammograms, and a whole host of other things. You pay $0. The plan pays the entire amount. The plan offers 24/7, 365 free virtual doctor's visits, unlimited telehealth visits. The plan offers 3 $0 behavioral health, mental health visits per family member per plan year. This plan has very low copays for primary care specialists and urgent care visits. You see the copays here, $15 for primary care, $25 for specialists, and $35 copay for urgent care. Now remember about the Supreme and the Enhanced plan, the copay is all you pay. For the amount of visits you see listed, 10 visits combined with specialists and primary care, that could be 5 and 5, that could be 1 and 9, etc. Per family member, you only pay the copay. So $15, no matter what in-office services are performed, you don't pay the bill. The plan pays 100% of the bill. Okay. Not like a traditional deductible plan where you pay the copay and you pay the bill until you reach your deductible. No, not so on the Supreme plan. $15 copay, you pay zero, plan pays 100% of the bill. Example, dermatologist visit. You get a wart removed, okay? So you pay your copay, and the wart removal on a traditional plan, typically costs, let's say, $250. In this plan, all you pay is the $25 copay. The plan pays 100% of the bill. Now, what happens, let's say, after you use your visit limit up? One of the family members uses 3 urgent care visits in a year, and they need a fourth. Well, the first 3 were just $35. The fourth, then, that person would pay the full amount of the bill, and that amount that is paid then goes toward reducing the out-of-pocket maximum. Once the out-of-pocket maximum is reached in the plan year, then for covered services, the plan covers 100%. All right. So you see low copays for minor radiology, low copays for labs, low copays for major radiology like MRIs, PET scans, CTs, etc., and a $350 copay at an ER. Each family member gets 1 visit to the ER per year. That's just a $350 copay. It's incredible. And if you need a second visit, remember that second visit you'd pay, and that would go towards the out-of-pocket max. Down here on surgeries and hospitalization, again, a $350 copay for an admission to the hospital, $350 copay for a surgery. So somebody might pay a $700 surgery. I mean, isn't that incredible, right? And once again, after the limits are reached per person, okay, the person needs a third outpatient, hospitalization or a surgery, and then that amount goes toward the out-of-pocket maximum. Once they reach the out-of-pocket maximum, the plan covers 100% covered services, okay? You see low copays for treatment for chemical abuse and dependency, low copays for home health. There is a maternity benefit here on the Supreme plan. So your doctor's bill is going to be $350 and the delivery is going to be $350. All right. Patient advocacy, healthcare navigation, high cost prescription advocacy, and medical bill negotiation included on the Supreme Health Plan. Also, 100% coverage for ACA mandated prescriptions, so you'll pay nothing. And then a 4-tier copay plan for other prescriptions. You'll see their pricing for the Supreme Health Plan is absolutely reasonable, typically 20, 30, even 40% less than a comparable plan.